It may start subtly, a pressure on the eyes, redness, discomfort, until one day you look in the mirror and you don't even recognize yourself. It's called thyroid eye disease, and doctors say there is hope to get back to normal. If the eyes are the window to the soul, then Joan Hamm is bearing it all.
I was always really aware of my eyes.
She thought she could handle it, that she could make it go away.
I just couldn't fathom that in this day and age there's nothing you can do to stop this protrusion of the eye.
The Southern California mom suffers from thyroid eye disease, a bulging and swelling of the eyes.
Patients don't look like themselves. The eye bulges out so far, it becomes uncomfortable for them. They feel a deep ache behind the eye.
Dr. Don Kikawa specializes in TED, thyroid eye disease. He says it occurs from an immune system attack that targets the thyroid gland. And most who suffer from this also have Graves' disease, a hyperactivity of the thyroid.
The eye is housed in a box called the orbit. It's a bony box, and the tissues have no place to go but to bulge out. And the tissues get so swollen that the eye actually can dislodge.
Here at Shiley Eye Center at UC San Diego's Medical Center, Joan Hamm is seeing a dream team.
This disease touches every part of the eye, and that means you need various specialists.
Each specialist works side by side, so when her disease stabilizes, she'll look like this again.
And if you can learn to accept that, then I think it makes it a little bit easier going through it.
It's all part of the TED journey, the pain, often not the worst part.
Imagine you wake up and you look in the mirror and you don't look like yourself. That's devastating to people.
We've had people who have said their grandchildren have been afraid to be with them. It really interferes with everything that they do.
6 out of 7 TED sufferers are women, but when men get it, it's often more severe. Kathleen Flynn, who heads the Graves' Disease Foundation, says it's all about awareness.
When you're diagnosed with something like that, it's very, very scary. And, you know, you need information. And when you do get the information, it goes a long way.
Once a patient gets a proper diagnosis, there's a light at the end of the often dark tunnel. The surgery seen here on a patient with extreme TED is that light.
It's not cosmetic surgery. This is something that's reconstructive or restorative that gets somebody back to where they were before the disease devastated them.
We don't actually remove the eyeball. All we do is gently push it aside.
Dr. Kikawa and Dr. Bobby Korn work together to remove bone from the orbit and to take out the fat that causes the swelling.
So by removing some of this, it allows our eye to settle back in.
Even with just one eye surgery complete, the difference is remarkable.
She'll feel almost immediate relief from the pain and pressure.
Joan Hamm is counting the days until her surgery. She says she's no longer afraid.
And I think that's comforting, that there's an end, and there's an end that would be positive. So this was just a means to that end.
Dr. Kikawa says 1% of the population suffers from thyroid disease, and about 10% of those get TED. He says if you see any changes in the appearance of your eyes, if your vision has dimmed, if you feel a bulge or swelling in your eyes, to get checked by an ophthalmologist immediately. He says too often early stages of thyroid eye disease are misdiagnosed as allergies. For more, go to our website, myfoxla.com.